Good morning, Sri Lekha.
Hi, Vishmaya. Happy Women's Day.
Thank you and wish you the same too.
Thank you. Hi, all. எப்படி இருக்கீங்க எல்லாரும்? Hi, Meghla. Hi, Indrani, Anushya, Kirti.
Hi, ma'am.
Hi, ma'am. Happy Women's Day.
Thank you, thank you, thank you. எத்தனை பேருக்கு இன்னைக்கு விஷஸ் வந்தது? How are you feeling? Anybody can share it? Okay, let me check. Our ma'am is there with us. Hi, ma'am. Amudha, ma'am. Yeah. Vismay, just take care. I'll be back. I'll just give a call to ma'am and I'll join.
Sure, Sri Lekha.
For a few years. ஸோ உங்களை சுத்தி உங்க மக்கள் இருப்பாங்க இல்லையா? ஸோ இந்த கேள்வி நீ கேளு அப்படிலாம் சில பேர் எல்லாம் நம்மள பக்கத்துல உட்காந்துட்டு நீ கேள அப்படியெல்லாம் சில பேர் சொல்லுவாங்க. ஸோ அந்த மாதிரி கேள்விகளா இருந்தாலும் ப்ளீஸ் எங்களுக்கு ஃபார்வர்ட் பண்ணுங்க. நாங்க டெஃபினட்டா கேட்போம் அந்த கேள்வி எங்க.
Hi, good morning, Vishmaya.
Good morning, Kirti.
Yes, how are you? Happy Women's Day and also.
Thank you, Kirti, and wish you the same.
Yeah, thank you. For my sister having one medical issue regarding thyroid, because she can't able to eat something like any of the thing. But some month it was low, some month it was higher. What shall we do for that?
Kirti, doctor is yet to join us.
So she's trying to join. She's joining from hospital. So maybe like because of that, she's finding it some issue. Just give us a few minutes, Kirti. So Dr. Elaborata, she'll talk with us. Okay. Kirti, கேக்குதுங்களா? Kirti, can you listen to me?
Yes.
Yeah, so I could see Amudha ma'am ID here. Hi, ma'am. Hello, ma'am. Ma'am, you are in mute, ma'am. Amudha ma'am, you are in mute. Yeah.
Hello, Lekha. Am I audible?
Yes, ma'am. Hi, ma'am. Yes, ma'am. You're audible. Thank you, ma'am, for your wonderful time. So thank you so much. I know how was the day today. Happy Women's Day first.
Happy Women's Day to everyone.
Yeah,
Happy Women's Day, ma'am.
So many young ladies are waiting to hear you what you're going to say us. I just request Vismaya to welcome you. Hi, Vismaya. Please over to you.
Good morning, ladies and gentlemen. If gentlemen are present for today's talk. It's a great pleasure and honor that I extend a warm welcome to each and every one of you as we come together to celebrate the essence, strength, and achievement of women around the world on this auspicious occasion of International Women's Day. As we gather here today, we are privileged to have with us a remarkable individual whose dedication to women's health has been nothing short of inspiration. Dr. Amudha Hari, a senior gynecologist whose passion and commitment to her profession have touched the lives of countless women, stands as a beacon of empowerment and compassion in her field. Dr. Amudha Hari's journey is a testament to the power of perseverance and determination in breaking barriers and shattering all stereotypes. Her tireless efforts in promoting women's health and well-being serve as an inspiration to all of us gathered here today. Ma'am, I want to also introduce our staff and Desi crew to you. Desi Crew was started off in 2005 as a project at IIT Madras, which later became a private firm in 2007. Today, we have 65 to 70% of workforce with women in it who lead the way for us. So let us all join our hands, hearts, as we celebrate the achievement of women everywhere and recommit to ourselves to the pursuit of equality, justice, and empowerment of all. Once again, a heartfelt welcome to Dr. Amudha and to all of you who have gathered here. May this celebration be a reminder of incredible strength, resilience, and spirit of womanhood. Thank you, ma'am, and welcome to this session, ma'am.
எனக்கு தெரியுமா அவங்க பண்ணா தெரியுமா? Hi, good morning everyone. Lekha?
Good morning, ma'am.
Okay. Am I audible first?
Yes, ma'am, you are.
Yes,
Okay. Happy Women's Day to everyone. 1 minute. Huh?
yes, ma'am.
Lekha, if I want, you will be sharing the PPT, no? If I want.
Yes, ma'am. Yes, ma'am. My
No
PPT is ready. I can share it.
Okay, fine, thanks.
Yeah, ma'am.
Happy Women's Day. One important thing is, if we are not going to celebrate ourselves, who is going to celebrate our womanhood? It's always a happy occasion to meet a lot of good friends and during a Women's Day. I particularly feel this is all is important. Why we must talk, you must all think why we must talk about health. Because nowadays every information is available on the internet. What language is comfortable to everyone? I don't know that, I'm sorry.
Ma'am, both English and Tamil we are comfortable, ma'am. Both the
Okay,
languages
fine.
are comfortable.
Please stop me if you want to understand something what I'm talking. It is
Sure.
not big science. I'm not going to talk physiology or pathophysiology. Just our what is most important in women health and what it has an impact on our life.
Yeah, ma'am.
It's where I'm going to possibly talk about 15 or 20 minutes, and I would really welcome. Is it everyone? Is this only women in this forum now?
Yes, ma'am. Yes. Oh,
Okay,
absolutely.
then feel free to ask any questions. Let's
No, ma'am.
discuss it. This is the best time we can have a happy interaction. So let's go ahead. See, women health. Why it is important to talk about women health? Because let us just start with something. Let us say you have a bad headache today, and you have come to the office. Someone is giving you a small award for the day. Will you focus on the award or the headache? You have no choice but to focus on the headache because your head is splitting. Why I'm saying is health is, we don't focus on it because we don't focus on it. As women, we hardly focus on it. We only focus on other things of life. But health is something we don't understand the importance till it is lost. So as and when we have to also have some focus on health. Because as a woman, most of the time you are the axis of the family. So if you are unwell, the whole family has issues. And I always see women, if they have the child is not well, which day you take them to a doctor? The same day, correct? The child is running temperature. You take them the same day. If your husband is not well, at least 2-3 days later. But if you are unwell, you will put off all reasons not to go to the doctor. I have some important family function, my office, I have a lot of work. Sometimes I have women coming with heavy bleeding. I ask them, how long you've been having this? They say at least 6 months, 5 months, 8 months. We thought it will stop. My friend said, this is the thing you have and take these remedies. All we try, all tricks of the trade till you fall really sick. You go to the doctor. Most of the time. This is one part of the story. That you ignore it because you think other things are more important than your health. But unlike, what do you think is completely wrong? Because if you are healthy only, you can take the whole family's well-being in a very positive way. Because if you are having a headache, let's say your child comes and asks you a question, first thing you will do is like ஒரு பட்டுன்னு ஒரு அரை விட்டுட்டு அப்புறமா பேசு அப்படின்னு you will tell. Because naturally, no, you don't, when you're not well, you cannot really attend to any of your basic family issues also. One. Second is the other spectrum of the, I am very, very fitness freak, you know. I exercise 1 hour a day, I go to gym, I go to walking, I do must health check every year. All that is fine. But these are also some of the 10% of the women who are hyperly, no, when there is an ad saying 1 in 250 women get a cervical cancer, you start worrying about cervical cancer. Then there are, these days, there are a lot of things, so much of information available in internet that all the time, even for a severe hair loss, you say, what are the reasons? Immediately you Google, first things comes is not anemia, cancer. So all of us think, is it possible? I have something very serious, a problem, that I have such a severe hair loss. But it could be a simple anemia. I can share with you some story. One of my patients, I wrote for, she had irregular periods. I asked her to do an ultrasound pelvis. The next day when I was operating, I'm continuously getting calls from this girl. Continuously, no, vidama phone pandranga. So I thought something wrong. They have picked up some major mass or something like that. So I'm telling her, please come to the pre-operative theater room, and you can see that she has been crying the whole night. You can see her puffed up face, everything. And I asked her, what happened, ma? What happened? No, I did an ultrasound like yesterday. What did you say? Okay, they have found PCOS, severe PCOS. I said, okay. She said, no, I Googled everything. Now I cannot have a child. I don't think then I am worth marrying. She has gone to different levels. See what happens nowadays. Every patient I get as an ANC or anything, particularly when I book for pregnancy, one of the instructions I give is please don't Google too much. Because as a human being, what happens today, you do a MHC, you have a problem, you immediately Google, find out all the negative impacts about it. And human mind is such that when you see information, the negative information goes in first. Never a positive information. Positive information, you have to go on saying. But negative information, immediately goes into the mind. And they start worrying, giving so much of focus, so much of energy into the negative thought process. All these are things that has a great impact on today's young women life. Another thing is, which we didn't find so much even about 7 to 10 years back, is some sort of an anxiety all the time. Let it be a young child who is going to school, or it is a young teenage person, or it is a grown married woman who is working. Stress and anxiety has become it is, to that extent, it is also a little fashionable to say I am very depressed. To that extent, your anxiety has a major impact on the health. Now, why you are anxious? Once again, let me tell you another story. There is one woman who walks inside my consult. She says, madam, she is just going to be about to be married. So she has come for a premarital, lot of counseling. She wants to understand. That's perfect. That's good. But then she says, I have certain requests. I said, go ahead. Please tell me, what is it you want? She says, no, I'm going to marry now. I don't want to have child for the first 2 years. Then 3rd year, I want to conceive. Then I am planning to go on site on either 4th or the 5th year. So I want to travel. So I want to finish my pregnancy 3rd year. She put in a calendar for the first 5 years. How she has to be. I said, stop. This is not your project. You cannot put timelines and deadlines, and you cannot set targets. It's not happening. Because what happens, why I'm sharing this is, nowadays, because women also has a career, she has so much of stress at work, then she has to run family, then there are children, then you have, where is your personal time? Almost nothing, very less. And you also feel guilty about using your personal time for yourself. You said, I could have done this and that during that time. So what happens is, when you set targets and it doesn't happen, Let us say third year she is not conceiving. What will happen to this girl? She'll go crazy. She'll become so anxious, so stressed out. Because I have seen couples, first 2 years we were using contraceptives. Third year, we are trying for the last. They would have come. They said, "Madam, it's not happening. We would like to go for some fertility treatment." Okay, I said, "Married how long?" I said, 3 years. Then how long you're trying? First 2 years we are using contraceptive. Now we are trying for the last 3 months. 3 months you're trying and it's not happening. You want to go for fertility treatment. Because you have set targets and it's not happening and you're very stressed out about it. So what all this as a background I am trying to tell you is, health is very important. You must give some focus and energy to it. Let it be some simple way, a lifestyle or anything, or a regular checkups when you really require it. So health is something you need to have a little bit of a focus. Second, please don't let your anxiety and your, it's good to plan. I'm not saying don't plan, but health is not something like you can have your fingers on and say, this has to happen and it will happen. I want to be pregnant in the next 3 months. It doesn't happen. You will get very, very stressed out. So health is not something that you can plan meticulously like a project. So it is a accumulated effort of your lifestyle. And third and most important is, information is good. Please have a knowledge. Understanding is important to have a healthy mind. But at the same time, please don't read everything and start thinking, let not the Google be your doctor. Because if that happens, you have so much of information, you don't have the expertise to discriminate it, then you end up having a lot of stress even because of your health. So with that as a background, now we are going to have a little bit of an interactive question and answer for the next 10 minutes. Then I'm going to welcome some questions. Lekha? Okay, then let me see whether I am not very...
Yes, ma'am. Yeah. So, do we have any questions? Makkale edavadhu kelvigal irukka ma'am?
Idhula question irukka mudiyuma? Na onnume information.
Illa. Ma'am, they were already prepared with some questions. Illadhu kekkalam appdinu solli.
Oh yeah. Please go ahead. I want it to be completely interactive. There is nothing that is not available in Google today. What I want to share is my experience so that helps you.
Okay. So we had Kirtana initially. Kirtana, would you like to go with your question?
Yes, Srilekha. Yes. Hi, ma'am. Good morning. First of all, happy Women's Day.
Happy Women's Day, Kanna.
Ma'am, for my sister having a thyroid, how to control it? That's what
See, one thyroid is, this is an interesting question in the sense, thyroid, if there is it is hypo or hyper, Gamma?
Hypo.
So mostly hypothyroid is very common in teenage girls and young women. It happens, one, innately there is some deficiency, or it could happen because of severe stress also. That is a recent teenage girl. Usually there is a lot of hormonal imbalance happening during teenage. They are trying to become women. You are setting into menarche. So naturally this is one age when there is a thyroid problem. So thyroid problem, you have to take thyroid tablets. Depending on the deficiency, your doctor would have prescribed some thyroid tablets which has to be taken early morning before tea. Now this question comes with most of the patients. Oh my God, now I have thyroid. Do I have to take it lifetime? Is there, can I be without medication? See, the thing is that there are two types of problem. One is something like a disease or an infection. Another is something like deficiency. Whenever there is a deficiency, definitely you need to take it for a longer time. Sometimes if you are young and it has happened because of stress, it corrects by itself. So what you can do is you can take off for a couple of weeks and then test and see whether your thyroid is normal. Even then you will have to keep a constant check. Second is you will have to focus on your lifestyle and diet. If, for example, in a thyroid patient, you will have to avoid soya, You will have to avoid cauliflower. You will have to avoid cabbage. And you will also have to do minimum 15 to 20 minutes of exercise because you need a better metabolic rate. These are simple things that can help in a long way. How old is she, Kirtana?
Ma'am, she is 26.
Okay, no problem. Don't worry. Ask her not to worry.
Sometimes for some of the months it should be normal, and some of the times it was above the point like that.
That's what I say. Don't go into all this. If your doctor has prescribed 25 mcg or 50 or 12, whatever it is, just take it and do the food correction and do the exercise. That's all.
Okay.
You don't have to worry about it. Once you correct it properly, it will no way hinder your health.
Yeah, sure, ma'am.
Srilekha, can you start the PPT? I don't know where I need to do this.
Yes, ma'am, I'm sharing it. Yeah.
Okay. Can I also see it if it happens?
Yes, ma'am. Yes, ma'am. You can also see it.
Okay. See, I'm going to ask very simple things. This is going to be interactive. At least I want someone of you answering. Just run that. I'll tell you. Next, Lekha.
Is this fine, ma'am?
Yeah. This is okay. I can also change.
Oh, no, ma'am. Only I can change. Like.
Okay. Go ahead. Go ahead, ma. Go to the next slide, ma. It's not moving, eh?
You're able to see, ma'am, now?
Yeah, I'm able to see. Okay. Please go ahead. Change, Lekha.
Okay.
Go to the next one. It's not opening, no problem. We can talk.
Vismay, you're able to see the screen, right?
Yes, I'm able to see the screen.
Okay.
Okay. What is this? That's the first one, huh? I think there are some slides before that, no?
Yeah, I was presenting from the beginning now, actually.
It's okay. Last question. Let Lekha bring it to the first slide.
Yeah.
I want to know, most of us are middle-aged, anywhere between 20 to 40, no? In the group?
Yes, ma'am. Yes.
Okay. I'm going to ask one question. Is every month getting periods is mandatory? Is that only normal or what is normal? Anyone can just share their opinion.
I think getting period every month seems to be normal.
No. Every month is normal. Is there any other opinion?
On 28 to 32 cycle is normal.
If it is 35, not normal, huh?
It's 28 to 35 days.
28 to 30. Okay. What else? That's all? Any other opinion? One more?
Yeah, ma'am. Every month period is normal.
Okay. So the answer to the question is, it does not have to be every month. Every body has its unique feature. For some, it is. So let us say in a 1 to 100, for 100%, about 60 to 70 will have it every month. That is the major. But it can be 30 days, 32 days, 40 days, 50 days. But it has to be what you call as irregularly regular. That is, you get it in a regular interval the same month. Let's say I have my periods and I have it every 40 days once. Then that is normal. For your body, ungalku adu definite normal. There is nothing abnormal about it. What happens? Then you say, what is abnormal? When you have regular cycles, let us say from my menarche, I'm having regular cycles. Suddenly, I don't get periods for 3 months. It has not happened for the last 3 months. Then that is abnormal. whenever you have a regular cycle and your period suddenly is showing a different pattern, let us say you are having 45 days regularly and suddenly it's showing a different pattern, that is abnormal and that requires a doctor's consultation. So whenever your cycle pattern, it is not the number of days, whenever your cycle pattern changes, you require consultation. Am I very clear? எப்பயுமே ரெகுலரா வந்துட்டு இருக்க ஒருத்தருக்கு சடனா அந்த பேட்டர்ன் மாறுச்சுன்னா டெஃபினட்டா அவங்க வந்து கைனகாலஜிஸ்ட பார்க்கணும். எனக்கு 30 நாள் தான் வரும், லாஸ்ட் எனக்கு பீரியட் வந்து ஆரம்பிச்சதுல இருந்து 30 நாள் தான் வரும், ஆனா இப்ப வந்து 2 மாசமா வரல அப்படின்னும் போது நிச்சயமா ஒரு டாக்டரை பார்க்கணும். அடுத்தது வந்து let us say you are having sudden abdominal pain. This happens in young girls. And you have sudden pain. We have seen lot of young girls going through an appendicectomy and laparoscopy because of this. Because, Lekha, please change it only when I say no. Lekha, am I audible to you?
Yes, ma'am, audible.
In the question, when I say change, please change. Huh?
Yeah, ma'am, okay.
Okay. So whenever you have pain, first a woman must see is, when was my last menstrual cycle? It was 2 weeks back. Now I have a discomfort. It is not severe abdominal pain. It is a discomfort. When you have a discomfort, then it could be that it could be an ovulatory pain. Now what is an ovulatory pain? Whenever the egg comes out of the ovary, there is a small bubble that is rupturing and the egg is coming out. Now that can cause a little bit of a pain for women, and usually some teenage girls will not be able to manage it. And that is the time when, if you are young, you need to wait, take a lot of water, rest, possibly one painkiller or an antispasmodic, and then also your your pain doesn't subside, you go to a doctor. You change now, ma? Lekha, change? Yeah. What is normal in relevance to menstruation? 3 to 5 days, 50 ml of blood loss, and about 1 to 2 pads per day. This is normal. Anything above, you're suddenly getting clots, or your periods is more than 7-8 days, or the bleeding is getting soaked. I'm changing 6 pads, 7 pads. Then you need to have a definite medical consultation. Yes, Lekha. Next. Can undue stress cause menstrual irregularity? Yes, it can. Have you seen 12th standard girl suddenly missing periods? Mothers bringing her, she is not menstruating properly. That is because 12th andane, what that everyone does. Everyone in the family say 12th study. They put a lot of stress on the girl. And even I find most of the time the mother to be more stressed than the girl itself. So stress can cause difference in the menstrual cycle. So you must always find a reason to and time to de-stress. Yes, next ma. So severe stress causes hormonal imbalance, and that can cause problem in the menstrual cycle maaraladanaala. Okay, next. So what is the symptoms that need evaluation in young women? Next, ma. So irregular or heavy periods, acute abdominal pain, and sudden obesity. Sudden I am putting on weight. Sudden excess hair growth. I am suddenly having hair in my face, hair near my breast. All that you need to have evaluation. Next. So these are the general changes. Skip. Just go through the sign. Okay, stop with this. அடுத்தது போங்க. அப்படியே இருக்கட்டும். So generally, because women more focus on health or beauty? Beauty. நீங்க சொன்னாலும் சொல்லலனாலும் பியூட்டி தான். I will wear a tight nylon brassiere but if it looks good, correct?
Yes, ma'am, 100%.
I will go through painful procedures if it does make me look better. And what is now let us define beauty. Please, one of you say who's the one of the beautiful women who come across whom you admire or something like that. Someone beautiful. Basically, they have to be beautiful.
Maybe Ambani's wife or Aishwarya Roy, I'll say.
Okay, good. அடுத்தது அப்ப you have to be multi-billionaire to look beautiful. அடுத்தது, of course, Aishwarya Rai is...
My grandma was a very beautiful lady. I should say now. My grandma. Her name is Bhagya.
Anyone else other than her grandma beautiful?
Mom.
என்ன இவ்வளவு நேரம் எடுக்கிறீங்க women groupல ஒரு பியூட்டிஃபுல்லான ஆள் சொல்ல?
Ma'am, my mom.
My mom.
சொல்லலாம், நான் கூட எனக்கு பியூட்டிஃபுல்லா தான் இருப்பேன் அப்படின்னு சொல்லலாம்.
Perfect. You must have told that first.
Yeah. So
beauty. Now that is what I wanted to say. Beauty is ultimately a lot of things put together. It is not your 32, 28 and 36 or 32. It is more. It is not your color. It is not your breast size. It is not this. It is not that. It is... There is a Tamil saying. I don't know how much of you know. There is a Tamil poet called Bharadiyar. Anyone of you know Bharadiyar?
Yes,
so,
ma'am.
person. So
Yes, ma'am.
You know. Okay. நிமிர்ந்த நடையும் நேர்கொண்ட பார்வையும் தெளிந்த ஞானச்செருக்கும்னு he says. That is your attitude. நிமிர்ந்த நடை நேர்கொண்ட பார்வைனா when you will have that. When you have a good attitude, no, you are happy about yourself. You walk happily. You walk with a lot of what do you say, happiness, and it really shows. This is an important thing. What he says, telinda ஞான செருக்குனா a knowledge that happens after a lot of discrimination. It is not just information. When you have a knowledge that has come and you have used it and it has become wisdom, then it is you have some that knowledge with experience becomes wisdom, and when you have the wisdom, you really, it shows in your way you handle yourself. It could be walking, it could be handling yourself, it could be a simple sari, but the way you wear it makes it more beautiful. So beauty is not essentially what our media and what others press say. It is definitely very internal. And everyone, because I find a lot of women worrying about their, madam, I am so less endowed, I want my breast size to grow, I want to become fairer, I want this, I want that. So many requests are coming because otherwise they find it, they are not matching with the social standard, which is not correct. You can be dark, but you can be beautiful, you know. It is all, you can be, it is more about your attitude, your education, your knowledge, your wisdom, everything put together is beauty. It is never one single thing. So please understand. And because I find so many of us are using, all of us, do we use, so many women use the whitening creams, injections, beauty treatments. It's okay. You need to groom yourself. I am perfectly fine with someone wanting to groom. உங்களுக்கு அழகா பண்ணிக்கலாம், நல்லாவே நீட்டா இருக்கலாம். You can spend some money and time for that. That all is welcome. But don't let your attitude and your self-esteem link to it. Your self-esteem must not be linked, because I have seen women who are obese or who are very dark having a very low self-esteem. I don't want அது நிச்சயமா தப்பு. நம்மளுடைய ஒரு தன்னம்பிக்கைக்கும் நம்ம எப்படி இருக்கிறோம், பார்வைக்கு எப்படி இருக்கிறோம்ன்றதுக்கு நம்ம சம்பந்தப்படுத்தக்கூடாது. நிச்சயமா நம்ம தன்னம்பிக்கை, ஆரோக்கியம்ன்றது நம்மளுடைய birth right, நம்மளுடைய உரிமை. அதை நம்ம we have to secure it for ourselves. அடுத்தது பொங்கலேக்கா, keep going. Just keep going. This was made for much younger girls. Keep going. Next, just stop with this photograph. See, at the photograph. Today, what happens is we have long hours at work, no? The minute we go home, what do? At least what do? I'll tell you. I switch on the TV and just lock myself and look at it. We don't even want to think. We want to just rest and relax. But at the same time, it is important that you manage to do at least 15 to 20 minutes of exercise and have a little bit of awareness on your food. Particularly when you are 40 plus, very, very important to focus on your diet. Because till up to 40, 45, the body takes care of you. After that, you have to take care of the body. So what are the healthy lifestyles? That is very important is you have to have balanced diet. Now, what is a balanced diet? Does it have to be you going to the gym as exercise? No. You can even walk inside the house for 15 minutes. But what is important in exercise is you do it the same time of the day. Then only the brain recognizes that as exercise and gives you the endorphins that you seek. Now, why do we do exercise? We require the exercise because we want the endorphins. Now, what are the 4 happy hormones? Serotonin, endorphin, and oxytocin and dopamine. Now, what are the activities that are connected to it? For example, exercise gives you serotonin. A human touch gives you oxytocin. One hug, one smile, one holding hand, any emotional bonding that immediately a mother feeding the child, breastfeeding releases oxytocin, which gives you the breast milk. But oxytocin is an important hormone for heart. Same way, there are foods that can give you a lot of dopamine. So like this, it is important that you have a balanced diet. There is a Tamil saying, unave marundu, marunde அதாவது நீங்க உணவை மருந்து மாதிரி சாப்பிடலன்னா, அதாவது யோசனை பண்ணி this is a good diet, am I eating a good amount of protein, am I having a balanced diet, am I having good fat? இப்ப என்னன்னா, it's a fat to do this diet and that diet and reduce everything. No. When you're young and you're healthy, you don't have a specific need, then please go for a balanced diet. Balanced diet, at least for example, for women, white kabuli chenna, murunga leaves, and kambu has so much calcium. Then you can have jaggery, any sweets with jaggery. It has a lot of calcium and iron. Like that, simple variation in your diet to your taste. It doesn't have to be something you don't like. So just go through that. Now use your Google. Find all the good foods that you want and possibly spot it in such a way that you eat the food you like, but you also have a balanced diet. Now, diet is very, very important because they say, unave marundu, abdi neenga seiyalana, unga marundu da ungalku unavu mari aidum. Marunde unavappa. You will be eating only tablets for your diet. So, it is important that you balance your diet. Then keep going, ma. Leka? This all you skip. So, next is weight. At the slide. Go, ma. So, that's all. Just leave that. So, what are the few important points when you want to be healthy? 15 to 20 minutes of exercise, balanced diet, and what else? Good attitude. Happy mental health is very, very important for your happiness and health. See, health, happiness is very, very linked. For example, what is the definition of health? Physically, mentally, emotionally, and spiritual well-being is health, not just the mere absence of disease. So, when you want to be healthy, you have to look into all the parameters. Next, ma. Keep going, ma. So, stop with this. Go back to the slide. This is how most of us look into our weight so that we see what we want to see. Go ahead. I leave all this, Leka. Go to the last. No. Go back. Do you want to? I will just touch upon contraception. Before marriage, nowadays it is very, very Before marriage, it is nowadays is physical. Now I get a lot of women coming to my consult with their partner or live-in partners, and when I ask, when is your last periods, this is not a joke, it is truthfully what's happening. She looks into that guy and he says the date. Okay, so having a physical contact pre-marriage is not a taboo anymore. How much culturally we get shocked or we morally get shocked, this is the practically that's happening. So it is important a woman has a knowledge about contraception, because who suffers when she gets pregnant? It is the women and not most of the time men. Men might get emotionally problem, but women get all the physical issues. So pre-marriage and immediately post-marriage, if you are having a physical contact and you don't want to have a child, condoms are the best method. After immediately after marriage, you can go in for oral contraceptive pills, because sometimes your husband or might not be interested in using condoms. After your first child, we suggest copper T to be the best method of contraception. But these are all overall, generally I'm speaking. You might have, everyone might have as personally a lot of issues and other requirements and your personal unique wants. So you need a discussion. I'm just saying generally what is the best. Okay. And pre-menopause also, we tried, we say it is best to go after your second child for a permanent sterilization, either for the male or for the female. Here, every time when you say, let your husband, can he have a sterilization only? It is the women who will come and say, no, 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 I will have it. Women are always, let me do all the hard work kinds. I don't know why, because I think we are all brought up with an idea. Socially, we have been feeding with that. If you are like this only, you are a good woman. So naturally, you tend to do certain things, whether you like it or not. I'm perfectly fine with anyone having a sterilization, but that has to come out of one healthy discussion and the requirement. Next, please. Please keep going. I've already... Now, the last slide I want you to do. First, we go before that. See, this is how most of the problem are. We think it is something else. Once you go through everything and you get a clear understanding, go to the next slide. This is how it is. So please never assume everything in life, more so in health. Don't get worried. Don't run your health by fears. It is just a simple lifestyle management, understanding, some amount of awareness, and a balanced way of thinking. If you have a problem, let me go to the doctor, understand what it is, and take steps. Instead of getting unduly worried and very fearful about it. Thank you. If there is any question, let's discuss. Otherwise, we can wrap it.
Yeah, that was very wonderful. Now, before we thought of asking, ஏதாவது கேள்வி கேட்க முன்னாடியே வந்து ஜட்ஜ் பண்ணி இந்த மாதிரி கேள்விகள் தான் நிறைய வரும் அப்படின்னு சொல்லிட்டு you have covered everything, I should say. But I'll just pose the things to the people. மக்களே, very good. I mean, உங்களுக்கு ஏதாவது கேள்விகள் இருக்கு அப்படின்னா please ask ma'am. She'll be very free to answer your question. So,
Hi ma'am.
Hi.
நான் ஜெயப்ரியா மேம். ஒரு சின்ன சந்தேகம். இப்ப ட்ரெண்டா இருக்கிறதுனால நான் இதை கேக்குறேன். இப்ப வந்து சானிட்டரி நாப்கின்ஸ்க்கு பதிலா அந்த கப் யூஸ் பண்ற, மென்சுரல் கப் யூஸ் பண்றாங்க.
டெஃபினட்டா மென்சுரல் கப் யூஸ் பண்ணலாம். முதல் கொஞ்சம் கரெக்டா தெரிஞ்சுக்கணும் எப்படி யூஸ் பண்ணணும்ட்டு. மத்தபடி மென்சுரல் கப் இஸ் a very comfortable thing. It's both is fine. If you're happy with menstrual cup, please go ahead and use. It's a good method.
Thank you ma'am.
Ma'am, I had a question on the similar lines. Some of the doctors do suggest that people who have fibroids should not be using menstrual cups. So just wanted to know if that is true.
No. See what happens, that has a reason to say that. Let us say your fibroid is in the cervix, அதாவது அந்த யூட்ரைன் மவுத்ல இருக்குது, இல்ல the shape is different அப்படின்னா menstrual cup application might be difficult, or it can get loosened and come off. That is the reason they say, otherwise nothing.
Thank you.
Yeah, thanks, Meena.
Okay. So I think all are very knowledgeable women, very less questions, but good. No issues. See, sometimes gynec questions and the personal questions are on a forum கேட்கறது கூட கஷ்டமா இருக்கலாம். I mean, you can take my number from Sri Lanka. If there is anything, that is also my WhatsApp number. If anything, I'll be happy to answer. Okay?
Ma'am, can I ask you some questions?
Please go ahead.
Ma'am, can you please talk about urinary tract infection?
Okay. One thing, that's a good question, ma, because urinary infection are very common in women. Why it is common? Na, women oda urethra is much shorter than men's urethra, so it's easy to pick up infection. And நீங்க பாத்தீங்கன்னா விமென்க்கு வந்து யூசிங் த ரெஸ்ட் ரூம்ஸ் அவுட் சைடு கொஞ்சம் டிஃபிகல்ட் தான், ஏன்னா நல்லா இருக்காது, டர்ட்டியா இருக்காது, நம்மளால நின்னுதா ரோட்ல நிறுத்திட்டு போக முடியாது. இந்த மாதிரி நிறைய ரீசன்ல என்ன பண்ணுவாங்கன்னா, ஸ்கூல்ல போற குழந்தைங்களும் சரி, வெளியில இருக்க வெளியில ஒர்க் பண்றவங்களும், if the toilets are not good, they find it very difficult to use. And if they are in a very male related situation, டக்குன்னு எழுந்து போறதுக்கும் யோசனை பண்ணுவாங்க. So அந்த மாதிரி situations what happen, you don't pass urine for a long time, அது ஒரு reason. You don't take enough water, அது ஒரு reason. There could be infection for various other reason also. Whenever you have urinary infection, you have first burning sensations இருக்கலாம். அப்போ வந்து it could be severe, just fluid intake கம்மியா இருக்கிறதுனா, if you drink enough water, tender coconut, lot of fluids, you feel better. But in case you're not feeling better, now please take a doctor's opinion, because a simple urinary infection can ascend and become cystitis, bladder infection. So if you have any urinary problems, consult your doctor and take treatment ASAP, because it is important for a woman not to have too much of pelvic infection. So ஒன்னும் இல்ல, நிறைய தண்ணி குடிங்க, நல்ல டாய்லெட் இல்லைன்னா முதல்ல போயிட்டு somehow manage to empty your bladder as and when you want, at least. Don't try to retain it. Drink a lot of fluids. In summer, take care. And good genital hygiene also helps. Dinakar varama. Okay then, Lekha, I think we'll wrap it up.
Yes, ma'am. Yes. Yeah, ma'am. I'll just check with do we have any last final question, then we'll wrap it up.
Yeah, this will be the final question. If then they can always WhatsApp me with something personal also. I don't mind answering.
Sure, ma'am. Sure,
I actually have a surgery at 12.
Oh, so, great. Okay, ma'am. So I'll just wrap it here. Fine. So Jaipriya, would you like to say your Jaipriya?
Ma'am, ரொம்ப thank you so much, ma'am. Time spent பண்ணதுக்காக.
No problem. It's always a pleasure to talk to women.
அது ரொம்ப முக்கியமான விஷயம். அது ஒரு டாக்டர்ஸ்னாவே எங்களுக்கு கொஞ்சம் பயமா தான் இருக்கும், இருந்தாலும் கொஞ்சம் கம்ஃபர்டபுளா நாங்க கேட்டு. இல்ல மேம், அததான் மேம் சொல்றேன், பொதுவாவே ஹாஸ்பிட்டல்னா கொஞ்சம் பயமா இருக்கு, இருந்தாலும் கொஞ்சம் டவுட் எல்லாம் கொஞ்சம் கிளியரா கேட்டுக்க முடிஞ்சது. அதனால ரொம்ப தேங்க்யூ சோ மச் மேம் எங்களுக்காக பேசினதுக்கு.
தேங்க்யூ மேம். Thanks, Lekha. And I thank the management for inviting me. Thank you, Gana. All the best.
Yeah, ma'am. Thank you, ma'am. Thank you so much.
Thank you, ma'am.
Yeah. So team, as ma'am said, I'll be sharing her number in WhatsApp in our DC Live community group. So if you have any question to ma'am, you can ask.
Just in that WhatsApp, because I will not know whether it's my patient or this from the talk. You can put DC Live, so I will know it's from.
Sure, ma'am. I'll collect the questions from me. You will get the questions, ma'am. So I'll be the one way person to come.
Thank you. Have a happy and very interesting life. Thank you.
Thank you, ma'am. Thank you. Thank you so much.
Yeah, ma'am.
So thank you all for joining with us on the live and making sessions. So upcoming more sessions are there on the live. Please stay along with us. So Vismi are also going to engage us. So we'll update what are the shows is going to upcome. So thank you so much once again, and happy Women's Day to all. So share if you have any question, please text me in WhatsApp number. I'll just forward that that question to Amudha ma'am, and I'll get the answer for you all. Okay. Thank you all. Thank you all. Thank you.